It's funny how you can go to sleep as one person, but wake up feeling like someone brand new, fresh out of the box. This is what happened to me, an experience that changed me as a person.
Baxter Moseley was healthy, active, and competitive. He was, that is, until he hit a growth spurt, growing almost 8 inches in just half a year.
The more he grew, we just noticed his chest. We just noticed a little bit more, that it became a little more noticeable.
Well, when I was in middle school, we had a PE program, and it was real tough and real physical, and I had it with all my friends, of course, and we would always see who could do the most and who could run the best and the farthest, and I got to where I couldn't do what they could, and kind of noticed that my chest was kind of different than everybody else's.
Every time he got a cold, it would turn into the bronchitis, and he would start wheezing, and we did allergy tests with the allergy. Well, no allergies showed up. He showed up negative for everything. That eventually led us to Birmingham and Dr. Chen.
So Baxter came to us with pectus excavatum. It's a chest wall abnormality where the chest is sunken in, and it tends to cause shortness of breath, chest pain, and then also self-conscious problems. He really did have a severe defect. It was deep, and it was impressive to look at.
Fortunately, surgery was an option.
You put a bar behind the chest to push that defect straight up so that immediately after surgery the defect is corrected. The risk from the operation is that we are passing a bar between the heart and the chest wall, and that's a small space. And there's a small percentage of patients have had heart injury from having this bar pass. That's never happened here at this hospital, but that's a discussion I always have with them.
On June 13th at 5 a.m., I was on my way to the hospital. As the nurse rolled me into the operation room, I faintly remember quiet good lucks coming from complete strangers as if they could sense my nervousness. The final piece of memory I can pull from that room was happiness. I knew my life of struggled breathing would end. It was one of the happiest moments of my life.
Dr. Chen had warned the recovery would not be easy.
It was painful at first, but I'll go through any kind of pain just to get it fixed. It kind of went away pretty quick because I only had to take the medicine for about a week, and then I was doing fine. I don't feel anything now. I feel, I guess, normal.
Later, when Baxter was asked to write an essay for an English class, it was all about his experience at Children's. His mother was so proud. She shared a copy with Dr. Chen.
It's very humbling to be on this side, to have these patients trust us to take care of them, and to be able to do an operation that, at the end of the day really isn't that complicated and change the lives of these kids. It's very gratifying, and this is why we do what we do, I think.
Just 2 months after his surgery, Baxter was literally reaching new heights in Gatlinburg, Tennessee. We
decided to hike one of the toughest hikes, the chimney tops, and I decided to challenge myself to see if I can do it and how quick can I do it. And I was surprised at how quick I actually got to the top, because the recovery was 6 months, but there I was 2 months later on top of a mountain looking over everything. It just made me feel great about myself and what happened to me. After how much they've done and helped me, hopefully I can do anything I want, and one day I'm going to come back and make sure I thank them for that, because I owe them a lot. I owe them my whole life now, pretty much. So I'm going to make sure I be the best person I can be because of that.